Health is a state of complete physical, mental and social well-being, and not merely the absence of disease or infirmity. It's a basic human right, essential for a long and happy life, and something we all strive for. At VicHealth, we understand this. Since 1987, we've worked in partnership with organisations, communities and individuals to make health a central part of our daily lives. Our focus is to create good health by tackling the conditions that lead to chronic disease and making positive changes to the world around us. We call all this health promotion. In the last 3 decades, health promotion has developed into a hugely important area of work across the globe, and for good reason. Chronic conditions such as type 2 diabetes, heart disease and some cancers, as well as anxiety and depression, all present huge challenges to the health system as they're expensive to treat and burden families and communities through pain and suffering, loss of income or productivity. Stemming from a complicated mix of risk factors, including lifestyle and behaviours, chronic diseases cause half of the deaths here in Australia, costing our economy $267 billion a year. But the good news is that many of these risk factors can be modified, and death and disability from poor health can be prevented. Encouraging lifestyle change is one way health promotion works to modify risk. But when we look deeper, we see that it's about more than just encouraging lifestyle change. There are also more complex underlying elements that contribute to illness. These are known as the social determinants of health, and they include your income, your cultural background, your gender, whether or not you work, where you work, the type of house you live in, your level of education, and even the strength of your social support. For example, if you're unemployed, you're more likely to live in poor housing, have limited social support, and thus are more likely to experience stress, anxiety, depression, and you're more likely to smoke. Similarly, if you're from a culturally diverse background, you may experience racism, which can also lead to stress, anxiety and depression. Health promotion works to address issues like these by supporting strong social networks, advocating for respectful relationships, encouraging attitude change, developing healthy, safe and supportive communities, ensuring research informs efforts and supports good public policy, and working to reduce health inequalities. In other words, health promotion equals multiple wins. For example, by developing healthy environments, we work to encourage people to be more active. A 5% cut in physical inactivity across the population can save 1,000 lives and has the potential to save $48 million in health costs annually. Or, supporting a person who is likely to experience racism through strong social networks in the community, we work to prevent risky behaviours such as tobacco use. And if we can reduce tobacco smoking by just 4%, we can save 3,000 lives each year. See, it really can make a difference. At VicHealth, we aim to reduce the significant costs of treating chronic disease, enhance economic productivity, bridge the health gap between certain population groups, create healthier places for people to live, inform government policy, and most importantly, improve the quality of people's lives. If you'd like to know more about health promotion and what we do, visit vichealth.vic.gov.au.